Now, state border closures are sparking incredible distress for the border communities when it comes to accessing medical care and employment. The South Australian government has announced a hard shutdown of the Victorian border. Cross-border exemption permits for residents of far Western Victoria have been scrapped. It's an issue the federal government is set to speak about at a cabinet meeting this week, but ultimately it's a state issue. Joining me now is the federal member for Mallee on the border of Victoria and South Australia, Nationals MP Dr Anne Webster, and also nurse Di Thornton, who owns her own primary healthcare practice. Thank you both very much for joining me. Anne, South Australian Premier Stephen Marshall has defended this border closure. He says it's necessary to stop the rise in infections in regional Victoria. There's about 13, the last I heard, active cases on the border and 50 in the Bendigo Council area. Do you recognise that this may be necessary?
No, look, I don't, Shari. I think that regional Victoria and our cross-border communities are being used as a buffer or a moat, if you like, to keep our sister states away from Melbourne COVID central at this point in time. While there's anxiety about COVID-19, and we all respect that and understand that, I do not believe that the blanket restrictions that have occurred have assisted in actually managing regional centres who are actually doing very well and have been doing well for 4 months. And what it's created is a fear that, you've heard the narrative that Victoria has COVID out of control. Well, it's just not true. It's not true in our regional Victorian areas. It's certainly not true in Mallee. We have 11 cases and have had 11 to 16 cases in total for the last 4 months. It has caused tremendous grief for our cross-border communities, Murrayville, Caniva, Eden Hope. There are people who live 12 kilometres from the border and who rely on basic needs and necessities, including medical care, that 12-kilometre distance. As of Friday, they will not be able to access it. It's really untenable, and it's also unjustifiable.
Yeah. Look, I want to bring in Di Thornton. You're a nurse, you live in Murrayvale in Victoria, and you run a medical clinic in Pinaroo, South Australia. Yet, as I understand it, you won't be allowed to go to work under the new rules that start on August 21, and some of your staff won't be allowed to go to work either. Is this right?
That's correct, Shari. We've got 5 of us on our staff who all live in Victoria, and unless we are granted exemptions, none of us will be able to go to work. And that will be 3 days a week in Pinaroo in South Australia that won't get a service.
Well, Anne, tell me about who is affected the worst by this, by the fact that they've scrapped the exemptions as well as the border closure. Is it families who are trying to get medical treatment? Is it people trying to get to their jobs?
It's all of the above.
It's everyone, but yeah, it is all of the above.
Yeah, you can both. Let's start with you, Di.
Certainly, Anne's been instrumental in the last few days in granting or lobbying and granting 3 of our acutely ill patients who require life-saving treatment down in Adelaide hospitals, 2 children, 1 adult, all lower than 50 years of age, and they weren't able to get that treatment without Anne lobbying for us and getting them exemptions.
And one of them, as I understand it, is a mum was absolutely desperate because her daughter has cancer and needed the treatment.
Absolutely. So her little daughter, Dana's little daughter, is 3.5 years old, and you can imagine the heartache of a mother having to walk through that process. And then now to be told, at a time when she actually needs a procedure, that she is not allowed to go. She applied 3 times and was refused 3 times. Breaks my heart that these situations, which are already heartbreaking, are made even worse by these draconian rules. And I have been sending lists. I have pages of people who are contacting me right now, all up and down the South Australian border, from those communities in Victoria, seeking some support to get exemptions. I've got one lovely man who is suffering with squamous cell carcinoma. He's had many surgeries. He's in a terrible way. And the doctor in South Australia, 12 kilometres away, could not see him in the building. He had to see him in a car park because apparently he was a COVID risk. All of our cross-border communities are having today COVID-19 tests. We are fundamentally free of COVID-19. There really is no medical evidence or justification for this kind of inhumanity.
And just to clarify that there, when you said the mum whose daughter has cancer and she was refused treatment 3 times, what were the reasons for refusing that 3 times?
Well, I think it's the system that actually needs tweaking. What we have is an online system, and I've seen her declined application, and there's no appeals process.
So that was an application for an exemption that she was declined 3 times.
Yeah. And the hospital, I mean, Di can tell you more about this, but the Royal Adelaide and the Royal Women's and Children are also, look, fundamentally, I think that they have been instructed that they should not be taking Victorian patients. It's untenable. These people have to go there.
Well, Di, isn't the problem as well that if these people are already sick, already immunocompromised, if they are forced to travel an extraordinary long distance and go to a Melbourne hospital, a hospital that's likely overrun with COVID-19, that would put them at high risk of catching coronavirus as well, and the consequences could be fatal.
Oh, absolutely, Sherry. And in Dana's daughter, Josie, we actually looked into whether she could have the surgery in Mildura because that was the next closest tertiary centre, and they don't do it. So if she wasn't able to get the exemption, the only choice for her would have been Melbourne, and Dana just said, no, I'm not risking it.
Yeah. Well, look, the Prime Minister has written a letter, for the family of 2-year-old Mabel, and he said it's a fundamental right of Australians to access medical treatment. But the problem is he can't intervene in every single case. It's just not possible. Not everyone can get their case heard through him. So, this system does need to be improved. Thank you both very much for your time. Really appreciate you raising this issue.
Thanks, Sherry.
Thanks, Sherry.